So thank you very much. It's good to be here. I'm the culprit, you just heard. I'm a primary care doc. I'm the one to blame in these areas. I prescribe opioids. I have for years. 20 years ago in the military, I practiced for 20 years in the military and continue to see patients in a little different way now that I'll explain in a minute. I got opioids and prescribed them. I was told that these are fantastic. Use these for acute pain, but if you need to, you can continue them on because they're not addictive. And the drug detailers came in and said that. We figured out after more research and now an epidemic that that was not true. And in fact, about 15% of individuals have a genetic predisposition to become addicted if they're prescribed. And we ought to be looking for other alternatives in those areas for pain. But taking away opioids is not the solution, because simply removing the opioids without replacing it with something that's as equally relieving in acute pain and is doing something to treat chronic pain is going to leave the 100 million people with chronic pain and the $600 billion costs untouched. And so we need to be able to bring in other effective approaches to treat chronic pain, especially in these areas. So I'm a primary care doc. I mentioned that I was in the military for 20 years and saw patients, did standard conventional medicine. I still see patients down at Fort Belvoir today every week, but now I practice in an integrative health clinic that the military has stood up. And in that clinic, we have a team of practitioners that looks at improving pain function and a lot of the comorbidities that go along with that, especially for military folks like PTSD, depression, and this type of thing. And it takes a team approach. It takes an integrative health approach. Let me define that because I think that actually is the solution. Integrative health is the combination of the best evidence-based practice from all kinds of approaches, wherever they come from, as long as there's good science indicating that they work and they can actually be incorporated into good care. It is focused on health. Notice I didn't say integrative medicine. I said integrative health. And this is especially important in pain because most of the management of chronic pain actually does not sit in the doctor's office. It's in the person's lifestyle and behavior, in their sleep, in their movement, in their nutrition, in the stress and stress management that contributes to and aggravates the pain, PTSD, and other things in those areas. And so integrative health means integrating the healing capacity of the person that they have in their own life space, in their own life, and beginning to put that together with good medical treatment in a package that delivers that. That's much more than just throwing a modality at somebody. It's much more than just saying, let's substitute this treatment for that treatment. It means bridging, as was mentioned by Dr. Siegel, medicine to self-care. And this is what integrative healthcare is. So there's some great examples of that, and I see patients every week. I go in once a week into the integrative clinic, and I see patients every week like someone that you can go and watch online to see exactly what happened to him, a Sergeant Yates. And I saw a man now 20 years later after a Sergeant Yates-like event who was in a movie called Escape Fire. So if you want to really see what integrative health can do, go watch that movie. It's available, online. Sergeant Yates was in a firefight in Afghanistan. He had been deployed multiple times. And in that firefight, he got injured, and one of his buddies got killed. He got physically injured in his back, in his side, and his leg. He had a traumatic brain injury. And he was evacuated back to Germany and then ultimately to Walter Reed. On his way back, he got snowed under with medications, including opioids, to treat his pain, his anxiety, his stress, etc. So that by the time he got back to Walter Reed, he was on literally a bag of pharmacological agents. And you can see it in the movie. He opens the bag up and shows you how to do that, what he was taking. And he was just managing. During the time he was at Walter Reed, one of his best buddies died of an opioid overdose. And he said, I've got to do something different. So in the very bowels of that hospital were other types of approaches for pain and PTSD. They actually were there, and he could have access to them. And in the movie, it shows you how he goes into integrative healthcare delivery that continues to prescribe medications for him. He needed the medications, but adds to that in a coordinated way team care of physical therapy, mind-body practices, acupuncture, and manipulation, including chiropractic, because there's a great chiropractic clinic at Walter Reed that integrates with those areas. And you see him recover. You see him tap into his own healing capacity and recover, markedly reduce his medications, improve his function. And as he walks out of Walter Reed, he's a new man. He's a new person. Is he completely cured? Is he over the trauma of what happened to him? No. But he now has some skills to actually manage that as he goes back into life. Patients like Sergeant Yates and the military, which is really first out in terms of integrative healthcare, much more than our civilian groups today, are examples of what's needed in the area of healthcare to address the opioid epidemic and the pain problems that are accompanying it and that are a lesson. So the lessons here really is that we need a system that balances itself like that's happening in those places. We have a system that is very imbalanced. We spend double on health care in this country than any other country in the world, and we're about 37th on health markers in terms of outcome. So we are not getting our money's value, largely because we wait so long to do expensive treatments at the end. We invest 90% of our money into treatment modalities when we could have prevented or engaged in health promotion that could have actually recovered that. Only about 5% of our dollars go into preventing the very things that we're trying to treat with things like opioids at the end. So the lessons learned here, again, is integrating healing and curing in the best sense of the word. Now, when I got very interested in this in the military, and I got exposed to these types of things which were called, back in the 90s, alternative practices, or complementary practices, I realized that I don't call them arrows in the quiver, I call them things in my medical bag. I needed more tools in my medical bag. And so I began to look around for good evidence-based approaches. And in the early 90s, there wasn't a lot of evidence. We didn't have a lot of science. We didn't know what to do in those areas. And so I took a little stint as director of the Office of Alternative Medicine at the NIH and helped create the Center of Complementary and Alternative Medicine. It's now called the Center for Complementary and Integrative Health. Very good word, name change. And it has a major focus on pain and pain management, because these kinds of practices now have enough evidence to show that they are effective and ought to be used in these areas. I then ran a nonprofit funded by Henry and Susan Samuelis from California to fill in more of the science in these areas, because there really wasn't enough science. And so we did science in the areas of integrative practices and healing-oriented practices for over 15 years. 700 publications, 60 books and meetings later, we've now filled in many of these areas. We've now filled in our knowledge base in those areas. And so an example of that is specifically in chiropractic is that Henry and Susan started a program, a center, a research program at the RAND Corporation that has a major emphasis on chiropractic research. And in fact, this very week at the World Chiropractic Association, being presented across the street, is a lot of the research from that RAND Center being presented by Ian Coulter and others. And if you want to see it, walk over there and take a look at it, okay? It's illustrating that for acute back pain and neck pain now, we have evidence to indicate that it is effective. We didn't know at the time whether it was effective for chronic pain. We now do know that it's effective for chronic pain in those areas, especially back pain. What we're now looking at is the whole issue of appropriateness of use. This is different than does it work or not. This is it being used properly? And this is where you have to get back to the whole issue of integration, because if you're not integrating it in an appropriate team care, it may not be being used properly. And so again, the military is first out, and the VA is actually way ahead of the game than our civilian counterparts in these areas, because 98%, thank you, 98% of military installations currently have chiropractic embedded in their delivery systems, and they work in teams. I'll give you an example. In the Navy, out at Camp Pendleton, they've created acute emergency and they're not emergency, I'm sorry. They're acute pain management teams that involve physical therapy, orthopedic surgeon, primary care doctor, sports doctor, and a chiropractor, okay? They go out into the field to actually deliver this care in a coordinated and integrated way. That's the way it needs to be done, okay? It has to be done together with good medical care in those areas. Now, on the civilian side, and not saying that the military solved all these problems, but they're actually demonstrating the kind of models that are needed. On the civilian side, there's many gaps still. Because, as Dr. Siegel said, your average primary care doctor who sees most of the pain patients doesn't know how to work in one of those teams. They don't have those kinds of practitioners available on how to do those kinds of those modalities. The incentives do not pay them to do this, so why should I spend my time doing that when I have hard enough time making ends meet at the beginning? And there's still stigma. There's still things, well, that was really quackery, and that's not really good medicine, and they don't know the evidence in those areas. And so Sergeant Yates, now out of the military, Mr. Yates, okay, back in Arkansas, where he came from, unfortunately is now not doing as well as when he left Walter Reed. Recent discussion with him indicated that he's been, in fact, back on many of the drugs that he was off of when he left, and he's not functioning as well as he did. He's still suffering from PTSD and chronic pain because he has not been able to access the integrated kind of care in those areas. So the Samueli Foundation, Susan and Henry, who I work for, has recently started an integrative health programs effort to try to fund the delivery of integrated care so that the civilian and practitioners out in the nation can take advantage of that type of effort. Thank you.